Hello and welcome to our video discussing the fundamental and derived position in therapeutic exercise. Today, we will explore the importance of understanding this position in order to effectively design and implement exercise program for rehabilitation and improving physical function. Let's dive in. First, I wanted to enumerate the fundamental position. When you're sleeping, that means that you are in lying position. If you want to be in hanging position, you should sitting and standing and finally kneeling position. Now, I wanted to mention derived position. I'll start with derived position from standing. There are many maybe alternating of the arm, such as wing standing, bend standing, reach standing, stretch standing, and finally yard standing. Maybe alternating of the leg, such as two standing, stride standing, walk standing, half standing, finally step standing. I give you the background, fundamental and derived position, but I want to explain more to understand the importance of it. Let me start by wing standing. As we see, the hand rests on the crest of iliac, the finger which are extended and adducted, the thumb posterior, the wrists are extended, forearm are pronated, elbow flexed and shoulder adducted. This position have uses like allowing the physio to grasp the patient during trunk exercise or amplifying movement during exercise. Second, stride standing. To describe this position, we see that he stands on both legs with one foot in front as if it has taken a step. Keep weight on both feet and maintain good trunk knee arch positions. It uses two strength leg muscles in weight bearing position and balanced position. Then, walk standing. It's one of position derived from standing position by alternating of the legs. The 2 foot lengths apart and are on the same line, so the body weight is equally distributed between them. It uses to prevent the rotation of the pelvis towards the side of forward leg and localize the rotation of the spine. Finally, prevent forward tilting of the pelvis in the trunk flexion exercise due to tension of hamstring muscles. After that, yard standing. As we see that position involves standing with the feet, the body relaxed, and the arm hanging naturally by your sides. It uses in various sports and activities over stability and control. It's very important for better aim and balance. I talk about the derived position from standing, but now let me focus on derived position from sitting, such as stride sitting, right sitting, crook sitting, high sitting, cross sitting, and long sitting. Crook sitting. It's a kneeling position with the buttocks resting on the heels and the chest supported by the thigh. It's used for improves ankle flexibility, strengthens calf muscles, and relieve lower back pain. Second, long sitting. As we see, the body is bent at the hips and the trunk is raised from lying to an angle of 90 degrees, with the knees are extended so that the whole leg is supported. It used for stretching hamstring muscle. After that, high sitting, as we see, is taken on high planks, with back support or on a stool. It uses for convenient for foot and ankle exercise, balance, and preparation to standing exercise. Now, I'll focus on position derived from lying, such as crook lying, crook lying with pelvis lifted, half lying, broad lying, side lying, and finally sit lying. Let me start with spine lying. As we see that the patient lies on his back and his body is erect with head and neck in neutral position. Eyes look up, shoulder at the same level, trunk is relaxed in neutral position, arms by the side, palms in contact with the table, pelvis at the same level, lower limb straight. It has many uses such as upper and lower limb surgery, upper and lower exercise, and physical examination. Prone position. As we see, that's the face of the patient down, with their head in a neutral position, without excessive flexion, extension, or rotation. Feet rest free from pressure may still further reduce the tension. It's used for corrective position for spine, and it's used for head and shoulder exercise. Then crook lying. As we see, it's a supine position with the hips and knee flexed, and the sole of the feet flat on the table. It's used for work on the posterior thigh and buttocks muscles, stretch the hip flexor, and relieve low back pain. After that, half crook lying. As we see, it's the same as crook lying with the hip and knee of one side are flexed, and the hip and knee of the other side are extended. It's used for relaxation and straight leg raising exercise to extend the leg. In sit lying position, we should know that it's also known as the lateral position. As we see, that the patient lies on one side of the body. The top leg is bent at the knee and placed in front of the bottom leg. It's used for stability and comfort, as it prevents nerve damage and unnecessary extension or rotation of the body. Now, I'll focus on position derived from kneeling, such as half kneeling, kneeling sitting, and prone kneeling. First, kneeling sitting. The position is stable from kneeling position. The patient sits back on the heels. It's used for balance, strength of back muscles, and stretching of quadriceps muscles. Let me focus on half kneeling. As we see that one knee supports the most of the weight, and the other leg is bent to a right angle at hip, knee, and ankle, so that the foot support on the ground in a forward direction. It used to stretching the forward leg sideways direction, and the pelvis is well fixed in this position for trunk side bending and rotation exercise. In conclusion, understanding fundamental and derived position empowers physical therapists to assess, correct, and enhance movement, ensuring optimal patient outcomes. This knowledge enables precise exercise perception, clear patient instruction, and effective monitoring of progress, ultimately promoting musculoskeletal balance and functional mobility. Thank you for watching our video, and I hope you enjoy it.